spaces on campus for students who test positive, as well as actions to help flatten the curve on campus in the spread of COVID-19. We are in the process of testing and moving current Massey Hall residents to other available rooms in order to create additional housing using Massey Hall. Our contact tracers tell us that the most likely place for the transmission of COVID-19 so far has been getting together in closed spaces without masks where people cannot spread out. That means in a car, in a dorm room for several hours with several other people, in an apartment crammed with people without masks for an evening, at someone's home for dinner where it's a small environment and no one's wearing masks. So we have taken actions aimed at getting people to take their activities outside. For the next 2 weeks, this is what we are doing. We will be eliminating visitation in all on-campus housing and allowing only roommates and suite mates to mingle inside residence hall rooms. If members of a dorm or house want to socialize with someone other than their roommate, we hope that they will go outside and wear their masks. Converting all dining to carry-out only. Dining still works in the same way it did before. We're not talking about brown bag lunches though, but the dining rooms are not available. Students can choose their selections in PCB or Stokely, for example, and it will be packaged to go for them. We encourage students to take their food outside, sit under one of the many tents we've set up, or go back to their room with their food. We will also be closing T-Rex for 2 weeks and moving fitness programming outside. We encourage all students to stay healthy by attending an outside fitness class, walking, running, and taking advantage of Knoxville's beautiful weather right now. We will be canceling all in-person indoor events across campus. Now, this does not include classes or CDC compliant academic programming because no cases have been traced to those activities. Events can still take place outside with masks and social distancing. We will also be performing comprehensive and systematic testing of all on-campus housing. There is no restriction on religious activities. The restrictions that are in place will be in place until at least September 27th. These decisions were not made lightly, but the significant increase in cases over the last week made them absolutely critical and necessary. During today's update, we will talk with Dr. Spencer Gregg, Provost John Zomchik, and Vice Chancellor Frank Cuevas about how we arrived at these decisions, why the measures are necessary, and how we will support students during this time, especially those who are affected by the residence hall move. But first, let's go over today's case count and isolation data. As a reminder, this information is on our coronavirus website, and it is updated every weekday morning. We currently have 672 active positive COVID-19 cases. 661 are students, 11 are employees. Well, if you look at that curve, what we're trying to do is flatten the curve and start it to go down the other way. Let's talk about quarantine or self-isolation. We now have 2,079 people in quarantine or self-isolation. Of those, 2,003 are students. You will notice an increase in on-campus self-isolations today. That is primarily because the students being tested before they move out of Massey Hall must quarantine while they wait for their results to come back. That is CDC guidelines. We appreciate these students filling out their self-isolation forms and doing what we've asked of them through this disruptive time. We may continue to see increased on-campus self-isolations as the testing of Massey students is completed. Now, one more thing of note about where we are. We also have had our first cluster in a residence hall in Whitehall. Now, as a reminder, a cluster is at least 5 positive cases linked together, or at least 20 close contacts as a result of one event or in one concentrated location. In this case, we found 6 connected cases associated with the second floor west wing of White Hall. Students who tested positive and symptomatic close contacts have already been relocated. Under the guidance of the Knox County Health Department and contact tracing team, all other students in the wing are quarantining and in place and receiving support from their contact tracers. Students on the entire floor have been notified and signage is posted there. We ask all Whitehall residents that you please follow the signage, follow the directions you've been given. So my first question this morning is for Dr. Gregg. As we always do, Dr. Gregg, as you look at these numbers, have we seen the impacts yet from Labor Day? A lot of people are concerned about that.
Well, good morning, Chancellor. Typically, we would anticipate the numbers secondary to a holiday, and this has been shown time and again through public health evaluations. We're going to see a lag of about 1 to 2 weeks before we expect to see the numbers start to increase from the holiday. So we potentially could be on the front end of an increase in the number of our positive cases and resulting close contacts. Maybe today through the weekend is when we would expect to see that number start to go up as a result of that.
Okay, so my hope on that is since we had classes on Monday, that maybe people weren't out recreating at the same extent as other kind of holidays, but we'll wait to see on that. So no, we probably haven't seen any increases yet due to that. Let's talk for a minute about the systematic testing we're about to unfold. These are, and the new measures that we're taking to try to contain the virus. So we are starting systematic testing across campus. The purpose is to identify hotspots, particularly in our campus housing. Our hope is that by doing broad testing, we can identify new cases of the virus before it can spread and use the data to determine what systemic measures we need and where we need them. So Dr. Gregg, I've got a few questions for you here. Can you talk a little bit more about systematic testing or this systemic testing and kind of how it works and why we would want to do it?
Well, our campus health testing involves several things. First of all, we want to evaluate individuals for their potential for exposure. We want to evaluate them for their symptoms, and we also want to do some broad-based testing. The symptom surveillance and exposure surveillance that we do is accomplished through completing our daily health self-check app. Our testing includes wastewater testing, which is testing effluent from on-campus residential sites. And it will be used as an indicator of where our focused testing efforts should occur on campus. Our focused testing efforts include pooled saliva testing of residents in housing units that we have shown have a likely case due to the presence of a positive wastewater screening. And then also PCR testing, similar to what we've done at Massey Hall here over yesterday and today. The goal of this program is really just to identify groups or individuals that are at greatest risk of actually being infected and unknowingly spreading the virus, and to protect those who are not yet infected.
Okay, so we'll be doing that kind of building by building of all university housing in a systematic manner. It won't all probably start at once. What can students expect when it comes to this testing as we begin rolling this out? What can students expect?
So over the next few weeks, students should anticipate a greater frequency of testing requests and potentially a greater number of quarantines of close contacts and isolations of those that have been identified as infected. This will entail an anticipated increase in temporary relocations of students from their current housing or the need to isolate or quarantine in place. Additionally, as we're focusing more efforts on surveillance testing, our resources for other testing measures may be strained. So to accommodate for that, through the Student Health Center, we'll be issuing by appointment to select patients at-home specimen collection kits. These kits are not rapid tests that will give results in minutes. They're high-quality PCR tests that must be forwarded to a reference lab for testing. Using these will promote rapid tests that will give results in minutes. There are high-quality PCR tests that must be forwarded to a reference lab for testing. Using these will permit us to continue widespread testing of others who are not being targeted through our broad-based testing. Students should understand doing an at-home collection kit will not permit them to still circumvent our ability to identify those who test positive. And every student issued an at-home collection kit will still be required to complete the self-isolation form and quarantine until those results are back.
Okay, and so students, as we move into this, will receive further explicit directions from the dorm or house that they live in. Is that correct?
That's correct. Whenever we will be going to an individual house or residence hall, the hall director or house director will be notified of our plans. We're typically going to give at least a 24-hour notice. And there's some actions that individuals there will need to take in order to facilitate the testing. Sometimes it's going to be the pooled saliva. The kits have already been distributed. The students should be having those available to them. They'll receive instructions on when to collect that sample and where to deliver that sample there in their housing facility. If we're going to do PCR testing on a facility similar to like what we've done at Massey Hall, we will notify them about that and ask them to schedule an appointment just like what we've done with Massey.
Okay, thank you. So just one last thing. Obviously, it seems like if we are testing more comprehensively, how will that affect the number of cases we see? It seems like they would be likely to go up.
Certainly, with these measures, we're going to expect an increase in the number of positive cases and oscillations, as well as resultant identifications of close contacts and the need for many to quarantine. But ultimately, the goal is just to reduce the incidence of both.
So is it fair to sort of wrap this up? I'm going to wrap it up and see if I've done it accurately, Dr. Gregg. Up to this point, we've been following CDC guidelines, which is we were testing students who feel like they may have symptoms using the app, and students who are close contacts. Now, because of the kind of surge in our cases, we're going to move into a more systematic, comprehensive testing approach to look at the campus as a whole for hotspots. Is that accurate?
That's correct, and it's really because of the clusters that we've seen on campus that are really kind of moving us in that direction.
Okay. All right, so let's talk for a minute about Massey Hall. There may be people on the call who've been affected by that. I think I've mentioned before, we acquired a local hotel for the duration of the semester to use for isolation cases, but we anticipate needing even more space for students to self-isolate in the weeks and the months ahead. And so after looking at all of our different options, we decided Massey Hall was the best location for this space. But it means that current students have to be relocated, and we know that's disruptive. We've been communicating directly with these students and their families. I can't say enough about how great people have been. We know it's a significant disruption for students, and we're doing a number of things to help support them through this transition. So here this morning to talk a little bit about that transition support is Vice Chancellor for Student Life, Frank Cuevas, and Provost John Zomchik. So let me start first with Vice Chancellor Cuevas. Why did we pick Massey Hall, and why did we think that was the best place for isolation space?
Well, good morning. Massey Hall was selected primarily because for two reasons. First and foremost, it had the lowest occupancy. We were under roughly 70%. And then the other reason is it had provided us with the highest number of beds available for isolation housing. So those two factors contributed to us selecting Massey Hall as an option for relocating students.
So it's a large dorm that was not full, and it seemed like the easiest, least disruptive for the whole campus, and provides us the most spaces. So what does this mean, Dr. Cuevas, for other students in residence halls across the campus? How does this affect them, or does it affect them?
Well, what we want to do is provide as much support for all of our students who are being affected. So for students in other residence halls, we will have Massey Hall residents that are relocating to either completely vacant rooms in other halls, or where we have vacancies in either a room or a suite. So what we communicated with our students across all of our housing is that be prepared to welcome a new student potentially to your suite or your room. And we've also shared that prior to relocating Massey Hall residents, as it was alluded earlier, we're testing those students. So no student will be relocated until we have the results from their testing. So that we know that that will help us slow down the spread of COVID throughout the campus.
So if it's a negative test right now, they will proceed to move. If students in Massey have a positive test, they will remain in Massey to isolate until their 10-day period is up or they've been released by the health center. Is that correct?
That is correct. So that'll help us control the spread. And that's one of the reasons why we're testing, and whether they're choosing to go home or stay here on campus.
Okay. So talk a little bit about, Frank, if you could, about how are we supporting the Massey students who've been impacted?
Well, we recognize that this is a huge disruption for our students. So we want to make sure we put all the care and support in place to help our students, because this is not how they envision having to relocate after a couple of weeks being on campus. So the first thing we've done is we've set up a call center, and that call center has staffed with individuals from across campus, student life, student success, to help answer questions for students and their families. And we'll be running that call center all through next week. We're running it now through the end of next week. In addition to that, we have daily Zoom calls between 10 and 2 p.m. from staff with our Office of Latino Students, our Office of Student Success, our one-stop counselors, who are available to work one-on-one with students who have questions, who have concerns, so we can connect them with the right resources and the support that they need. We want to minimize the disruption of this transition as possible.
Okay, thank you. Another question related to Massey. I'm going to turn to Dr. Gregg. We have received some questions about, well, Massey has communal style bathrooms in that dorm. So can you explain why that is okay for isolation housing?
Yes, the Tennessee Department of Health has given approval to house individuals who tested positive together. We're able to do this because once an individual is positive, you can't become more positive just by being around others that have also tested positive. And being around others that are positive, if you are positive, is not felt to increase your severity or your risk.
So a kind of a related question is, if you envision people who tested positive are now going to be together on a floor, can they safely hang out together and socialize if they feel up to it? Or what's your advice about that?
People that are positive can interact with each other, again, because they're both positive. But it would still be important to minimize that as much as possible and to take appropriate health and safety measures that we've discussed all along, especially as we move into the flu season. That's a respiratory illness as well, and it's very readily transmitted. So we don't want to increase the risk of having an outbreak of the flu inside of our isolation housing where we're taking care of our COVID-19 patient.
Okay, so that's kind of the lay of the land about Massey. Let me just say in summary, in addition to the reimbursements and the help with the physical moving of spaces, we have reached out to instructors whose students are affected by the move. We are asking instructors to continue to practice compassion and flexibility, recognizing that having to move residence halls in the middle of the semester is really challenging. So Provost Zomchik, what are we doing to support students academically who are impacted by this move?
Good morning, Chancellor. Thank you. Yes, first of all, I think, and most importantly, we're reaching out and listening to individual students who are affected by the move. As you know, all of our first-year students have academic coaches, and those academic coaches have been contacting them to see exactly what kind of academic support they need at this moment that Vice Chancellor Cuevas has accurately described as quite disruptive, additionally disruptive. And we're connecting them to the appropriate resources on campus. It could be tutoring, a tutoring center, or supplemental instruction, or their academic advisors. And in some instances, if students ask us, we're reaching out directly to an instructor. And as you just mentioned a moment ago, we're also reaching out to our instructional faculty. For example, yesterday, Dr. Amber Williams, our Vice Provost for Student Success, and I held a Zoom meeting with about 50 faculty members to update them on the Massey move. I was really impressed by the attendance and by what I think was a kind of atmosphere of being compassionate and realizing that we had to do something extra for these Massey students. So we talked about having these instructors reach out to their students to accommodate their requests for extensions by rescheduling tests or due dates for assignments, or in some instances, devising alternative assessments to measure student learning. And I have a great sense that our faculty are cooperative and working. In fact, I read an email from a department head today instructing his faculty, reminding his faculty that this particular disruptive move really means that they need to be sort of extra aware of some extra support that our students might need. Finally, I also want to say that sometimes, Chancellor, as you know, students directly contact your office or they directly contact our office. And when that happens, we reach out here in the Office of the Provost to help solve problems and respond to the student's need. Oftentimes, this takes the form of a direct contact with a department head or a dean, so that they in turn can reach out to the individual faculty member who the student tells us about. So, I just continue to be impressed and proud and pleased by the flexibility and compassion and creativity of our faculty. And we're listening to our students. I encourage them to keep letting us know how we can help. These are just some of the ways that we're supporting them during this time.
Thank you very much. So let me just, in closing, let me remind everyone, we have a call center for anything associated with Massey Hall. And I'm going to give you the number right now. It's 865-656-7233. I'll say that one more time, 865-656-7233. We have people available to take your call. Any questions about Massey, the move out, the testing, all of that. So please take advantage of that number. And that's going to be actually a better number right now on that topic than my number or John Zomchik's probably. I want to talk about these other measures that we put in place since Tuesday. And I know they feel really restrictive. They are. But we are trying to take the steps we think are necessary to preserve this on-campus experience. It is my hope that with everyone's compliance, we can lift these measures on September 27th. However, if cases continue to rise, we may have to leave them in place longer. And there will be student conduct consequences for those who do not comply. So Dr. Craig, I'm going to turn to you one last time this morning. How will these restrictions, specifically, how can they help slow the spread of the virus?
Anytime that we can reduce the incidence of close contact, we're going to reduce the likelihood of infection spread. All these measures are directed to that goal. Unfortunately, a lot of these measures can come across as punitive, but that's not their purpose. The purpose is to reduce the likelihood of the spread of infection by decreasing the likelihood of close contact. It's still imperative during this time that everyone on campus continue to adhere to the CDC's basic health and safety guidance to protect themselves as well as one another and to avoid that close contact. Don't be within 6 feet of someone else for more than 10 minutes, and you won't be identified as a close contact.
Thank you so much. And thank you all for being here today. This is hard. And I was talking with students the other evening. It's inconvenient, it's hard, it's not fun. It's not what college is usually about. But if we do these things together, if we remember we're volunteers have always had to deal with hard situations. And every time they've stepped forward willingly in service and in leadership. What volunteers need to step forward with now is reducing the close contacts, at least for these next 2 weeks, to help us get these numbers down. So I want to thank everyone. Our employees are working hard, but it's hard for them as well. I appreciate all the efforts to contain the virus, and I'm inspired every time I go outside on the campus and see people trying to make this work. Please keep trying to make this work. We have challenges ahead of us, but I'm confident we can work together to begin bringing the numbers down and continue to provide an enriching on-campus experience. Not the one you wanted, not the one we wanted to be delivering, but an enriching on-campus experience here at Rocky Top for all of our students. I will see you again next week. Until then, mask up, spread out, and enjoy being with your friends outside. Thank you, and go Vols.